Your thyroid is a small, butterfly-shaped gland in your neck. Don't let its size fool you. It's a powerhouse, producing hormones that control your metabolism. That means it impacts your energy, weight, temperature, and even your mood. When your thyroid doesn't work correctly, it can lead to various health problems. These problems are known as thyroid disorders. They're more common than you might think, affecting millions of people. There are several types of thyroid disorders, each with its own set of symptoms and treatment options. Understanding these disorders is the first step toward effectively managing your thyroid health. Hyperthyroidism is like a car running low on fuel. Your thyroid doesn't produce enough hormones, slowing down your metabolism. This can lead to fatigue, weight gain, feeling cold, and even depression. The most common treatment for hypothyroidism is medication. You'll take a daily pill to replace the hormones your thyroid isn't making. Regular blood tests are crucial to ensure you're on the right dosage. Your doctor will monitor your hormone levels and adjust your medication as needed. While medication is essential, a healthy lifestyle can also help. A balanced diet with plenty of fruits, vegetables, and lean protein can support your overall health. Regular exercise can boost your energy levels and mood. Hyperthyroidism is like a car stuck in overdrive. Your thyroid produces too many hormones, revving up your metabolism. This can cause weight loss, rapid heartbeat, anxiety, and difficulty sleeping. Several medications can help manage hyperthyroidism by blocking hormone production or their effects. Radioactive iodine therapy is another option. You swallow a capsule that shrinks your thyroid, reducing hormone production. In some cases, surgery to remove part or all of the thyroid might be recommended. This is typically a last resort if other treatments aren't effective. Similar to managing hypothyroidism, a healthy lifestyle is important. A balanced diet and regular exercise can help manage symptoms and improve your overall well-being. Section 4. Thyroid nodules. Lumps in the butterfly. Thyroid nodules are lumps that develop in the thyroid gland. Most nodules are benign, meaning they aren't cancerous. However, some nodules can be cancerous or cause problems by producing excess hormones. If you have a thyroid nodule, your doctor will likely recommend monitoring it with regular ultrasounds. This helps them track any changes in size or appearance. A fine needle aspiration biopsy, or FNAB, may be done to determine if the nodule is cancerous. During an FNAB, a thin needle removes a small sample of cells from the nodule for examination. If the nodule is cancerous or causing problems, surgery may be recommended to remove it. In some cases, medication to suppress hormone production or radioactive iodine therapy might be used. Section 5. Thyroid cancer. Battling a butterfly gone wrong. Thyroid cancer occurs when abnormal cells in the thyroid grow uncontrollably. While it can be frightening, most thyroid cancers are treatable, especially when detected early. Surgery to remove the thyroid is often the first step in treating thyroid cancer. This may be followed by radioactive iodine therapy to destroy any remaining cancer cells. In some cases, hormone therapy may be used to replace the hormones your thyroid would typically produce. Radiation therapy, chemotherapy, or targeted therapy might also be recommended, depending on the type and stage of cancer. Regular monitoring is crucial after thyroid cancer treatment. This typically involves blood tests, ultrasounds, and other imaging scans to check for any signs of recurrence. Section 6. Managing your thyroid health. A lifelong journey. Managing a thyroid disorder is not a one-time event. It's a lifelong journey. It requires a proactive approach, working closely with your healthcare team. Regular consultations with an endocrinologist are essential. These specialists have in-depth knowledge of the endocrine system, including the thyroid gland. They can provide personalized guidance and adjust your treatment plan as needed. Regular monitoring is crucial. This may involve blood tests, imaging scans, or other tests to track your thyroid function and overall health. Patient education is also essential. The more you understand about your thyroid disorder, the better equipped you'll be to manage it effectively. Don't hesitate to ask your doctor questions and seek out reliable sources of information. Section 7. Conclusion. Take charge of your thyroid health. Thyroid disorders are common but manageable with proper treatment and care. By understanding the different types of thyroid disorders, treatment options, and the importance of ongoing medical management,